As people slowly stream in here, I wanted to just start off with answering the questions that we had on the Discord that came in from the last live that we didn't get a chance to answer. Then we'll talk all about what happens to your brain when you're unconscious under anesthesia with certain substances that your brain may have seen. And most of all, what does this have to do with mental health? And how is your body opening up like a book under anesthesia? And maybe you can actually control some of those untreated or undertreated mental conditions, health conditions when you're unconscious. Yeah, a lot of this is rooted in the powerful ability for even the unconscious mind to heal itself. All right, Neva, good to see you. Heidi, good to see you. Pika, Kirby, excellent. I love it. Y'all get shout outs right at the start. I love it. So a couple questions that we didn't get to answer was bromelain. So before we talk about the cool stuff about your brain and anesthesia, I got to catch up on the questions. Pineapple. What do pineapples have to do with surgery? Well, pineapple stem, as CEO of my life on the Discord mentioned, has a compound named bromelain, which may have some anti-inflammatory effect, may have some effect to help improve pain. I'll be real, the effect size is not terribly exciting to me. Maybe as part of a multimodal treatment plan, might be helpful. You always want to talk to your surgeon first though and your doctors because of the risks of interactions with anesthesia and the post-operative recovery. So don't take anything before you talk to your doctors. Amanda, good to see you on here. Good to see you, Amanda. All right, so, all right. Oh, I think we are all caught up. Oh, here we go. Women who have had, okay, chaperones in the operating room. So that what's up asks a really good question. Chaperones in the operating room. So this is a deep one here. I'll try to make it clear for a YouTube live, but yeah, PTSD is real in the operating room, especially in women who have had, or men or whoever, who may have had, as the question was, sexually assaulting experiences in the past. So obviously my heart goes out to you. This is terrible and like really, really hard. Under anesthesia and in the operating room, why does this come up? Because parts of your body are unrobed under anesthesia, right? It is what it is. Depending on what part of your body has to be accessed, you may need to disrobe, you know? Hopefully it's not everything, but it really depends on what kind of surgery you're having. I'll be real, most surgeries you're not taking off, you're not being kind of stripped down butt naked, but you are exposing some skin for the surgeon and the rest of the team to safely operate on, right? This can bring up PTSD experiences 100%, very, very real. So thank you for asking that question. Having a chaperone can always is always appropriate to ask for. Realistically, there are so many people in the operating room with you that you can select one of them to be a chaperone for you, and being open and honest with them about your past is one of the most powerful ways to use that surgery experience as a healing experience. Now remember, we're human beings. We are wired to get kind of amped up in new environments because new things, novel things, these might be dangerous to us. So we automatically go into defense mode. Our anxiety volume gets turned up naturally because you've probably never been in an operating room before with these lights and monitors and beeping sounds. So if you have somebody in this experience that you can trust to guide you through it, you may be able to use this as a wake-up call to tap into your inner healing potential to help better get a grip on your anxiety, on your depression, in the case of what you're asking about your PTSD. These are all related to an extent, and it can be augmented with the psychoactive anesthetic agents that we give you that cross the blood-brain barrier in this time. So I'm just scrolling here to see the other links here. Hey, I'm so happy to see people that popped over from TikTok. What special medications do you use for detethering of the spinal cord? Well, Bailey, from the anesthesia perspective, we don't use any special medications. We avoid certain medications that might confound the neuromonitoring to make sure that your spinal cord does not get inadvertently damaged during the surgery. Very good question. Okay, Amanda asks, no one asked me if I'd been assaulted before and I was wild in the OR. Why didn't they ask? So Amanda, very, very insightful, very, very insightful here. You have put together two concepts that most people never ever talk about, and most doctors probably don't ever think about. You just recognized how your past experiences determine how you wake up from anesthesia. People think it's because of the medications we give that cause, sorry, I'm just looking at the Discord here. Is everything okay on right? Okay, very good. I think everything's okay on the Discord. Just check in. You're very welcome. That's what's up. I hope that answered your question. Now, so having an experience of any type of trauma in the past can be amplified when you're waking up from anesthesia, because you might be hypoxic, you might be hypercarbic, you may have some pain. Maybe more importantly than anything else, you're disinhibited because you have all sorts of anesthetic agents, whether they be gas or IV agents, in your brain that are turning off your frontal cortex. And this is one of the things, like I said, when your body opens up like a book, it's because of this combination of extenuating circumstances that is affecting your body and letting it open up in ways that it may have never been opened up before. It might come out as delirium in the operating room. So patients that are depressed are more likely to wake up with delirium, either in the ICU, in the operating room, wherever, because of this powerful mind-body connection. So Amanda, thank you for recognizing this and putting it all together. You ask, why do you need so many painkillers in surgery? Well, Amanda, that can be for many different reasons, but patients that are depressed are more likely to have higher pain requirements because of the bidirectional effect of pain and depression. I should say pain perception and depression. Very good question. Nicole is asking, I'm afraid of needles and I need surgery. Is there a way I could be asleep before getting a needle? Very good question. Very good question. So, by the way, if you're learning stuff, please hit that like button or subscribe to keep up with these lives. I hope you all appreciate that after challenging days in the operating room, I still come on here to help you guys learn more about your bodies and learn more about how much healing potential you have. So your support helps me a lot. So do hit that like button and share with others. The question was about needles. You can't get anesthesia without an IV, except for a couple rare cases. And usually kids that are just too young to tolerate getting an IV. That being said, there's many ways to help the IV go in more easily. I talk about them on my website and in my other videos, but the short answer is that getting a little bit of lidocaine first helps a lot, and second of all, distracting yourself. I usually recommend patients to cough as I'm numbing their skin so that it helps distract their brain from feeling the first needle. It works very, very well, much safer than the alternative of going to sleep with only a mask and without a needle. Good question. If you get your period during surgery, what do you do? Neva, we actually don't have to do very much because we're already typically giving you antibiotics. So if you're worried about toxic shock syndrome from having a tampon in place, typically not a big deal. And we put pads on the operating room table, so it's typically not an issue at all. Now, I did originally, we got sidetracked for a couple minutes here. I wanted to talk about certain substances in the brain. In particular, what happens with stimulating substances. Have you guys ever heard of stimulating substances before? Things like, I'm sure you have, right? Cocaine, methamphetamines, etc. Do you guys know what happens to the brain when you have these things in your body? Anyone ever? I'm very curious. Very curious. What do people know about this? Hey, Amanda CM, thank you so much for the kind comments. I appreciate it. But I was asking, what do people know about your brain and what happens when you have these substances on board? It's kind of scary what happens. Well, unfortunately, there's a lot of self-medication, right? People that resort to these are sometimes people that are looking for answers for something else in life. Now, we don't have to get too metaphysical and, transcendental here, but there's typically a need, maybe an addiction, which is trying to solve an unmet need in the individual. So maybe it's depression, anxiety, loneliness, not feeling loved, etc., right? Now, that will affect the anesthesia. The medication itself affects the anesthesia as well because it depletes your body of catecholamines potentially. It can cause, like someone was saying here, like Amanda was saying, it increases your tolerance to anesthesia, so you have a risk of maybe being more aware because you are going to need a higher dose than we would have predicted based off your body weight. And when you go under anesthesia, you may have, sorry, I'm just trying to read all these comments. They're such great comments. Thank you all for the kind comments. When your brain has this, so your cardiovascular system can either wind up, you can have a hypertensive crisis, or it can actually crash. So I had a patient recently that crashed, despite not having used anything for many days, had enough effect on their body from chronic methamphetamine use that caused their blood pressure to crash. And it really broke my heart. I have a whole video on this that I actually did it because it was so sad. Somebody who took so much time off from work, so much commitment to having surgery, so much hardship to plan for recovery after surgery, for a major surgery that was hopefully going to cure them of a lot of chronic pain they'd had. We couldn't even do the surgery. I had to wake the patient up before we got started with the surgery because their heart could not tolerate the anesthesia. There were swings in the blood pressure that were so dangerous that I couldn't even let the surgeon cut because of the effect of the methamphetamines on their body. In addition to messed up vascularity, like they had all sorts of white digits. They wouldn't be able to heal their wounds. You know, a lot of things go into this, but suffice to say that the mental toll that addiction and these drugs take and the physical toll are very, very real. And they are nowhere perhaps more apparent than under anesthesia, even though the patient isn't talking to us because they had a breathing tube in their mouth. They had a breathing tube in their vocal cords. You can't talk if there's something between your vocal cords because your vocal cords can't move and vibrate to produce voice. But like I said, the body opens up. And it really broke my heart because so much hardship, so much pain, and I'm the bad guy here because I canceled the case after we went to sleep. How sad was that? It really sucked. It really sucked. Yeah, Pascal, I don't know what the question mark is for, but if you have a question, please feel free to ask it. I'm just sharing, these are the tough decisions that doctors have to make. And you know, if it was my mom or dad, I would want the case canceled. But I also recognize that this patient just lost a lot of hope, just lost a lot of the things they had sacrificed to make room for the surgery in their schedule, financial obligations, et cetera, et cetera. And here I am canceling it. And we had a long talk after because I'm not going to pretend like I can predict the future about what they're going to do next, but I hope, and I want to know what, I want to share this with you guys because it's in the deepest, darkest moments of our lives that a door might be knocking that we haven't heard knock before. And in that moment of a wake-up call, we might hear the door knock and we might be more likely to hear it and open it. And it might be something we never thought we'd experience before. You know, I know it took, 13 minutes to get to this point. This is what I wanted to come on for the YouTube Live, to have this discussion. You know, it's kind of hard to do this on TikTok Live sometimes, but I hope you guys can appreciate that. What a shame, what a terrible experience for somebody to sacrifice so much. But, and I'm not downplaying this is terrible for the patient. It's hard for me to say this, but is there not, I don't want to say a silver lining, but was there a twinkle in their eyes when we talked about this? And we talked about what happened to their body so far from the chronic methamphetamine use. They're still very young, under 40 years old. You know, they can still make a recovery. They can still come back in life. There's not been irreparable harm to their heart, to their lungs, to their brain. Their blood vessels may stand a chance at healing as well. But, you know, it takes a wake-up call. It takes trust in the guide. I hope I was able to guide them that day. I called them the night before. We had a long discussion. I hope I was able to be their guide. And then what's the catalyst for change? You know, all those psychoactive medications that we give under the anesthesia in that very vulnerable time. I describe it as a window. It's literally a window that you have. Not only is it a window for patient's body to express themselves, but it's a window for you to also interact with that patient. A window for them to figure out, to learn more about their body and to tap into a place they never knew possible. Have that door open up that they never heard knock before. Yeah. All right, I'm catching up here with the questions. Vervain for panic attacks. Okay, so catching up the questions. Pascal, not a particular strong, I've never recommended it to a patient. I'm not familiar with good evidence for that. I'm going to be honest with you. There are other types of ways of breaking panic attacks. You know, my favorite one is doing things like a Valsalva or a modified Valsalva with your breathing and diaphragm to reset your nervous system to help with panic attacks. Is anesthesia bad for children who have cerebral palsy? Fatima, not necessarily, especially if they need the anesthesia. Good question. My heart rate skyrocketed after a spinal tap for a C-section. Why would that happen? So, that could happen because when we do a spinal, I don't have the needle with me. I can grab the needle. I'm happy to grab a needle if you want. Let me know if you want to see a spinal needle. I can show it to you. When we give you the spinal anesthesia, we cause your blood pressure to drop. Your heart beats faster to compensate. And when it beats faster to compensate, it helps keep blood going to your vital organs, your brain, your heart, your kidneys, etc. Why you had persistent blood pressure after can be a whole different story. I can't answer that question for you, but in the moment, there is largely a result of the anesthesia medications that we're giving you. Why you may have had blood pressure low after could be for any number of reasons. All right. Amanda is saying that the patient was probably taking that drug because of their pain or affliction, and I agree with you. I agree with you, and this is why. Remember that, in the words of Lisa Miller and many other much smarter people who came before me, drugs are the cheap back door to awakening our consciousness, right? When we're pained from depression, anxiety, addiction, PTSD, etc., we're often longing for something that isn't there. That's why we fall into rigid cognitive cycles, trying to do something to heal ourselves. Well, if we don't have the right guide, what do we turn to? Radical ideas like religious zealots who radicalize people, or drugs or something. You know, people that are seeking something are going to look very hard to satisfy their longing, right? And I'm not saying it's their fault. This is like an innate calling that so many people have, so many patients have. I see it in the operating room every day when patients are so fearful of surgery. They have so much pain, so much cognitive rigidity built around an admittedly very challenging situation. But, you know, what else is the pain that they're feeling deep down that is fueling that mental state, that mindset? It's not blame, guys. It's not blame. But there is something that people are often seeking. And they turn to things like drugs. Like you said, Amanda, like this patient here whose surgery had to cancel. James, good to see you. Toopy After Dark, good to see you. Oh, Loopy After Dark. Loopy After Dark says coping mechanisms. You're right. Coping mechanisms can be powerful or they can be hurtful. Right? And the cheap back door is sometimes hurtful. And that's where you can see the effect on the body under anesthesia, even when you're not awake enough to talk to us. All right. I walked into my infusion center today and I had an anxiety attack. Well, Loopy After Dark, I'm sorry that you experienced that. If you're comfortable sharing with others, what did you do to overcome that? Pascal is asking, I'm in menopause. I used to meditate. Still can't get my panic attacks down with breathing. Hence why I thought about blue vervain. Well, Pascal, I'm really happy that you're working on breathing. That's very powerful. Controlling anxiety, there's a lot more that goes into anxiety than just breathing and supplements, though. And it has to do with the stuff we talked about previously, the 5 pillars, your sleep, social interactions, nutrition, physical activity, and mindset. A lot of things go into it. You know, YouTube Live is kind of hard to go into your specific personal history. I don't want to have to ask you private questions in front of everyone, but suffice to say that there is always a role for medications, but it does make sense to explore the non-medication avenues first before going on to medications that have side effects. Whether or not you're having surgery doesn't matter. We talked, I think yesterday, about tachyphylaxis and what happens to your brain when you take anti-anxiety medications or antidepressants for a long time. Or for that matter, proton pump inhibitors. When you shift your body out of a homeostatic balance, it tries to push back. It causes internal friction in the body, right? Responsible in part for rebound effects after people stop these medications. So that's why I don't want to say cheap backdoors in a bad way, but sometimes they have harmful side effects that are unintended if used for a longer period of time than necessary. So Pascal, I hope you appreciate where I'm coming from there. Amanda asks, the mindset, can you change it? Well, Amanda, that's a big discussion about cognitive restructuring. So if you haven't checked out the video yesterday, I talk all about it in that, the healing potential and cognitive restructuring, a lot of ways of doing it. But it does require a couple fundamental tools. And we said the guide, the wake-up call, and the stimulus. So check out that video, we go into it. Great. Maybe 2 last questions and we're gonna call it a day for this live here. I love everyone's, guys, if you're learning stuff, hit that like button, subscribe and share with others, please, so that we can all learn more from this, because I love your comments. Safia, it's sad to see how many doctors would just prescribe antidepressants without even trying alternatives. I agree. Loopy After Dark, I was able to go back to that floor 2 years later, but it took work. Yes, Loopy, I'm happy you were able to put in the work into it and have that outcome. A lot of patients put in the work and may not have the outcome they want. So I'm happy that you had the outcome that you wanted. All right, Loopy After Dark. Oh gosh, okay. So many good questions. I wish we had more time. Well, Amanda's saying that meds are not enough. Religion is not enough. Meditation is not enough. What else is there? Amanda, there is so much. That check out the blog articles that I have. There's a lot out there. I'm happy that you're trying all these alternatives. There's a lot more, and many of them with plenty of evidence to support their efficacy, so keep up your search. There's rarely ever a one-size-fits-all, and that's the art of medicine, finding what treatments and therapies work for individual patients, because it's not one-size-fits-all. Antihypertensives don't work for all patients. Chemotherapies don't work for all patients. There's certain selectivity, certain treatments that resonate more with others. So I'm happy that you're searching, and I do send you positive vibes, hoping that you find one that resonates with you. Okay, but let's end with Loopy After Dark story. I was hospitalized for 1.5 years. When in the ICU for 2 months, I was in a medically induced coma. At some point, I got violent, ICU fog, agitated. I was also abused by the staff. Well, Loopy After Dark, that's a very scary story, and I'm thankful that you felt comfortable sharing that. And I'm very happy that you're also seeking support for that traumatic experience. That's very, very tough. I hope everyone here appreciates you being vulnerable and sharing that story. And maybe one day you can share the coping mechanisms that you've developed, you found helpful, to help you through that really traumatic experience and help you work through it. I want to end with that story. Very, oh my gosh, very inspiring that you found a way to move on and hopefully heal and be stronger from that. Loopy, thank you. All right, well, I hope everyone has a good rest of the day. Remember that you have more power over your health than you've probably ever been told. Hope you all learned something. I hope to see you guys on a future live, and do check out the videos that I put up where we talk more about, where we talk more about these things. Check out the Discord. I love reading the comments here on Discord. Hope everyone's learning a lot. Take care, everyone. Hope to see you guys soon.